Assalamualaikum warahmatullahi wabarakatuh and very good morning. Welcome, honorable guests, ladies and gentlemen. Please be advised that the ceremony will begin shortly. Before we commence, please allow me to convey a few important announcements. There will be question and answer session at the end of the ceremony. So feel free to type in your query or doubt to the speakers and we will read it out at the end of the session. Second announcement, the host will share the feedback link as well as the attendance. So kindly do not leave the platform before the end of the event. So with due consideration, we hope that our event will run smoothly as planned. So thank you everyone for your cooperation. Honorable guests, ladies and gentlemen, welcome to the UniKL Farmasi Webinar Series 1.0 2023 organized by Klinikal Farmasi and Farmasi Practice Disiplin, Fakulti of Farmasi and Health Sciences, University Kuala Lumpur, Royal College of Medicine, Perak. Okay. First of all, I would like to introduce myself. My name is Sharifah Shamimi and I will be your moderator for today. So before we begin, I would like to share an interesting snippet on our series of webinar for today. So UniKL Farmasi Webinar, or those commonly known as UniPHARMINAR, is actually a knowledge transfer program initiated by Klinikal Farmasi and Farmasi Practice Discipline, Faculty of Pharmacy and Health Sciences, UniKL RCMP, to provide the staff as well as the UniKL staff as well as the public the practical tips and knowledge on the quality use of medication, correct administration technique, as well as the updates on the pharmacy issue and clinical information. So without further ado, to continue this auspicious occasion, it is a great pleasure for us to introduce our speaker for today. This is Miss Aina Amanina Abdul Jalil. So she is a registered pharmacist as well as a clinical pharmacy lecturer in Disiplin. So today, she will share her knowledge entitled The Use of Medicine During Ramadan. So without any delay, we are pleased to welcome Miss Aina to deliver her sharing.
Okay. Assalamualaikum. Okay. Assalamualaikum and good morning, everyone. Thank you so much to the moderator for the kind introduction. Okay, I'm going to share my knowledge on the use of medicines during Ramadan. Okay, basically, as the holy month is approaching near to us in next week, so I'm going to share my knowledge on this, the use of medicines, basically what invalidates your fasting and what does not invalidate your fasting. Okay, and I'm also going to share how are you going to adjust your medications when you are taking certain medications during Ramadan, right? Okay, fasting is common and widely practiced by the Eastern and Western cultures, and some of the reasons for fasting includes religious, health, and purification. So basically, not only Muslims practice fasting, we also have different kind of fasting, for example, like intermittent fasting. Okay, and there are various methods of fasting, includes refraining from eating and drinking for a few hours or months. Okay, they are also restricting the intake of certain foods to complement fasting according to their religious beliefs. Okay, in some other religions, they abstain from taking certain food, for example, like beef, so they become vegetarian for a certain period of time, and that is how they fast. Okay, for Muslims, however, fast means abstaining from eating any foods, drinking, and from doing anything which could invalidate the fast, starting from dawn fajr, which is before the sunrise, until the dusk, maghrib, which is approximately around 13 to 14 hours a day. All right, the necessary nutrients needed by our body during fasting remain the same and needs to be fulfilled. Okay, even though you are fasting, the nutrient needs to be fulfilled. And the thing that sets it apart is the food intake time. When you take your food, whether during the fajr or pre-meal, pre-dawn. Okay, fasting can discipline someone to eat food at a certain time and for a certain quantity only. Okay, it is recommended to take a complete and balanced diet during iftar, which is breaking of the fast meal, and sahur, which is pre-dawn meal, to keep a person healthy and active. Okay, so basically, even though you're fasting, it is expected for you to keep your nutrients in a balanced way so that you get the amount needed throughout your fasting period. Alright, so this is the most important part, which is the use of medicines and medical procedure during fasting, which does not invalidate your fasting. Okay, the first one, the use of eye drops or ear drops. Okay, basically when you use your ear drops or eye drops, when you instill those in your ears or eyes, that will not invalidate your fasting. Okay, other than that, sublingual tablet, which is put beneath your tongue. Okay, any types of tablet, it does not invalidate your fasting as long as you did not swallow the tablet. Alright, apart from that, performing any types of dental procedures, for example, like extraction, filling, cleaning your tooth, brushing your tooth, scaling, all those procedures will not invalidate your fasting. However, if you inhale, swallow any types of substance which is produced during the procedures, that can invalidate your fasting. Okay, other than that, injections, any type of injections through the layer of skin, for example, your skin, your muscles and all that, that will not invalidate your fasting. These also include insulin injection, okay? And then any types of blood transfusion, blood donation, or blood sampling that is taken to the lab, that will not invalidate your fasting, okay? We also have a cream and ointment which is applied on the surface of the skin. Okay, that will not invalidate your fasting. And also bandage or plaster that is also applied onto the surface of the skin, that is allowed and will not invalidate your fasting. Okay, and also catheter. Okay, catheter in this case is catheter which is used for inspection purpose. For example, if you use catheter in the terms of angiogram, in which it is inserted through your blood vessel to check, to examine your heart, that will not invalidate your fasting. Alright, next we have laparoscopy. Okay, laparoscopy, a procedure in which a laparoscope is inserted through your abdominal wall to check the interior of your body. Okay, and then we have mouthwash gargle. Okay, mouthwash gargle will not invalidate your fast unless you swallow the liquid. Okay, however, it is mouthwash gargle is it's almost to the throat, so you're not supposed to swallow it. If you swallow, that will invalidate your fasting. Okay, other than that, biopsy, a procedure that is done to collect a sample of your cells or any tissues to provide that to the lab, right? And then we have nasal spray, which will not invalidate your fasting. And we also have local anesthesia. Okay, local anesthesia is a procedure that is used to numb a certain area of your body, okay, and using a local anesthetics, which will not invalidate your fasting. Okay, and then the last one is hemorrhoid cream. This one is almost the same like the ointments now, the cream. Whatever is applied onto the surface of your skin will not invalidate your fast, right? Okay, now we move on to the use of medicines and medical procedures which can invalidate your fasting during Ramadan. Okay, the first one is taking oral tablet or capsules, consumption of these oral tablets or capsules, and then consumption of any syrup medicines. This can invalidate your fasting. Okay, other than that, using of inhalers. Okay, inhalers, for example, inhalers is a type of medicine which have like a pressurized medicine in which once you press the inhaler, this medicine will be propelled into your cavity throughout your mouth. Okay, so this procedure, this device itself, it can invalidate your fasting as it will go through your open orifice, which is your mouth. Okay, other than that, the use of pessary in women, which is inserted through the vagina, and also catheter tube into the urinary tract. Okay. All right, next is ureteroscope. Okay, ureteroscope is usually used for cleaning of the bladder. Okay, that can invalidate your fasting. Okay, and then we have enema and also suppository, which is usually inserted through the anus and rectum. Okay, and then we have the endoscope and gastroscope. Okay, these two in the layman term, it is called like intestine or stomach binocular, in which it is a thin narrow tube which is in which at the end of the tube it is inserted, attached together with a small camera, and then inserted through your mouth. Okay, and then the doctor usually will view your internal inside of your body using the screen. Okay, and the last one is full anesthesia, in which you have to inhale gas for you to obtain the anesthetic effects. Okay, so these are all the things that can invalidate your fasting. So if you do any of this, if you either take any of these medicines or perform any of these medical procedures, you are not, your fasting is not valid, right? Okay, next, how to take your medicines during fasting. Okay, for those who are sick, fasting is not an obstacle to continue with the treatment. You're not supposed to stop your treatment just because it is fasting. Okay, adjustments can be made to medication regimens to allow your fasting. Okay, meaning that for chronic patients, you're not supposed to simply stop your medication during that 1 month period of Ramadan. Okay, patients must be sensitive to their health status and get ready to break their fast if needed. Okay, for example, if you have certain symptoms that can threaten your condition, you can break the fast, right? And this is important to prevent any unwanted adverse effects. Okay, and it is very important to consult your doctor and pharmacist before making modifications of dose and time to take medicines. You cannot just simply adjust your dosage, your medicine, before consulting the experts, right? Okay, so this one, the general guide regarding the adjustments of medications regimen during fasting. Okay, so if you look here, okay, sorry. Okay, so basically, if you look here at the left side of the table, if the instruction is you have to take it OD once a day, 1 times a day. If the instruction is to take before your meal, so the suggestion is to take 1 hour before your sahur, before dawn, right? But if the instruction is once daily after your food, you have to take it after you break your iftar, right? So basically, anything after meal, it is easy because you can take it after iftar. However, if the instruction is to take BD 2 times a day, okay, if it is before meal, you have to take it at least 1 hour before your sahur. Okay, so if your sahur is around 5:30, you have to take it at least 1 hour. And then the second dose should be taken after your iftar, before you have the main menu, meaning that once the azan is heard, so you can take it before you have your food, or 2 hours after you had your iftar. Okay, that is for before meal for 2 times daily. But if it is for after meal BD 2 times daily, you have to take it after your sahur and after your iftar. Okay, that is easier. All right, for TDS dosage, okay, you have, if it is before meal, you have to take it 1 hour before your sahur. Okay, the next dose is after your iftar, before having the main menu, and the last dose should be before your bed, right? Okay, and if TDS 3 times a day after meal, you have to take it the first dose after sahur, okay, the second dose after your iftar, and the third one before you go to bed. And it is very important, very crucial for you to at least take a small meal before going to bed. Okay, at least you have something, because the medication is supposed to be taken after meal. So at least before your bed, you take a small meal and then you take your medicines, right? Okay, for a frequency of 3 times a day TDS or TID, okay, it is recommended to talk to your doctor to determine if the medicine can be changed to frequency of 2 times daily. Okay, usually what we do is, for example, like for metformin, if you're prescribed with metformin 500 mg TDS, sometimes the dose can be adjusted to 1000 mg BD. Okay, so meaning that you still the total dosage daily is 2000 mg, which means that you did not exceed the maximum daily dosage. So that is one example of how you can adjust from TDS to BD dosage frequency, right? And the last one, for 4 times a day or QID, okay, it depends on the type of disease, and you should seek advice from a doctor first. And it is advisable not to fast or use alternative medicines if you have any. So for QID, sometimes it might be hard for the patient to fast because you have to take the medications frequently, as to why in some cases you might not be able to fast. So otherwise, you just have to consult with your doctor and pharmacist to see if the dose can be reduced, the frequency can be reduced or not. Okay. All right, so these are some situations in terms of managing your medication during Ramadan. Okay, the guidelines on how to manage your medications based on the different doses and situations. Okay, so we have the first scenario. For example, if Hazim has been prescribed medication to be taken once a day after meals. Okay, the ideal time for Hazim to take his medication is, of course, after breaking the fast. Okay, after Azan. Right. Conversely, if he was prescribed with medication to be taken once a day before the meals, okay, he should take it before, at least an hour before sahur. Okay, so that is how if a person is prescribed with once daily dosing. Okay, if in another scenario, okay, Mila needs to take her medications BD twice a day, okay, and after meals, the ideal time for Mila to take her medication is after, the first dose is after the sahur, and the second one is after breaking the fast. Okay, and for medications to be taken, for example, twice a day, BD, before meals, Mila can take them either before sahur or after breaking the fast, but before the first meal, right? Okay. Next, for the next scenario, for example, Maisara is prescribed antibiotics to be taken twice a day, three times a day, TDS, and after meals. Like I said, after meals, it will be easier because you can just simply take it after your meals. But for 3 times, it's a bit confusing, okay, because we only have 2 times when we eat during Ramadan. So the best time for Maisara to take her antibiotics would be the first one, usually after breaking the fast, okay, after sahur and before bed. But make sure before bed she must take a small meal, okay, to ensure that her stomach has some food lah. Okay, if the antibiotics are to be taken before the meals, the best times are before sahur, at least an hour before sahur, after breaking the fast, but before the first meal, means right after azan and before bed. Okay. So the next scenario, the last scenario, scenario 4. Earlier this year, Alia was prescribed medication to be taken 4 times a day, QID, and before Ramadan starts, Alia made an appointment with the doctor for the best alternative on how she can continue fasting this Ramadan. So for QID, it is a bit confusing how to take the medication. So what you can do is to consult your doctor, and like I said, to see whether you can reduce the frequency of your medication to at least 3 times a day or not, as long as you don't exceed the maximum daily dosage of your medications. All right. Okay, insulin use during Ramadan. Okay, so now we're going to see a specific recommendation on how to cater the use of certain devices or medications during the Ramadan. Okay, so for patients taking insulin who wish to fast during Ramadan should have renal and liver function tests. Okay, as both renal and hepatic impairment may precipitate or prolong hypoglycemia in people with diabetes. Okay, so if you wish to fast and you're on insulin, at least you have to take your renal and liver function test. Okay, and patients taking insulin should be instructed on self-monitoring of blood glucose or SMBG and individual adjustment of insulin doses based upon glucose goals discussed before commencing Ramadan. Okay, so it is very crucial for patients with insulin to do SMBG or self-monitoring blood glucose. Okay, like I mentioned previously, during the medications or procedures that will not invalidate your fast, one of them is including injections, and apart from injection, your skin prick will not invalidate your fasting. So it is recommended for you to monitor closely your blood glucose if you're taking insulin during Ramadan, and do your SMBG, self-monitoring blood glucose, regularly. Okay, this is to ensure that you don't have any hypoglycemic episodes, or you can maintain your blood glucose within the normal level. Okay, and people with type 2 diabetes who are taking either the long-acting basal insulin analog or the glargine, okay, these kind of people, they are able to fast safely with no significant increases in hypoglycemic episodes. Okay, for rapid acting or the mealtime insulin, it is usually given at fast-breaking evening meal times. Okay. So if patients lose weight due to fasting, they may need a reduction in their basal insulin dose in the second half of Ramadan. So what usually for patient with insulin, what we do is we monitor first during the first half of the Ramadan to see if the patient has any reduction in weight. They may need, the dose for the insulin may need to be reduced to a certain level, okay, to ensure patient did not have hypoglycemia. Right, patients with type 2 diabetes on premixed insulin, BD, twice daily, should reduce their morning breakfast dose by at least 25 to 50% and take the normal evening dose with their sunset fast-breaking meal, right? So reduce their morning breakfast dose by at least 25 to 50%. Okay, and alternatively, the premixed insulin dose can remain the same. You can just use the same dose and add additional rapid-acting insulin to cover the iftar meal, because usually during iftar you eat more, so you can add additional rapid acting insulin to cover that. All right, patients who have an additional evening meal before the bedtime, when iftar is early, might also require rapid-acting insulin. Okay. Okay, so this is the recommendations for insulin regimens during your fasting. Okay, for example, if you are taking twice daily long or intermediate acting, which is glargine, ditamir, or NPH, the recommendation is to reduce one of the doses, either the morning or the evening dose, by 25 to 50% depending on your blood glucose readings. This is why patients with insulin is encouraged to regularly monitor their blood glucose level during fasting. Okay, and for a patient who are taking short-acting, for example, Lispro, Aspart, and Glycine, do not take mealtime insulin on the day of the fast. During fasting, you're not supposed to take your insulin, and you can start again when you are eating your meals, right? Okay, the risk of fasting in diabetes. Okay, hypoglycemia, one of the risks is hypoglycemia, which is already known. A prospective study by Luke S.C. et al. In 2010 concluded that the rate of hypoglycemia is 1.6 times higher during Ramadan fasting amongst type 2 diabetes mellitus patients compared to non-fasting period. So it is higher rate of hypoglycemia during fasting in patients with diabetes mellitus. Okay, other than that, we also have, apart from hypoglycemia, hyperglycemia, okay, which could happen when the diabetes medication dosage are reduced excessively to prevent hyperglycemia. Right, overconsumption of high sugar food during non-fasting period can also contribute to postprandial hyperglycemia. Okay, so another risk is hyperglycemia, and then diabetes ketoacidosis. Okay, poorly controlled diabetes prior to fasting month, besides over-reduction of insulin dose, can lead to diabetes ketoacidosis. Ketoacidosis is also more common among type 1 diabetes mellitus patients. Okay, and the last one is dehydration, the most common one, okay, in which during fasting you will have restricted fluid intake in addition to an extended fasting period. Or if, for example, you have a strenuous physical activity, and this can lead to dehydration. So these are the risks that you have to pay attention to if you have diabetes and if you are planning to fast during Ramadan. Okay, the risk of dehydration and hypoglycemia during fasting. Okay, these are the risks that you cannot avoid. It usually happens. Okay, for people with diabetes, a 2-hour sugar level monitoring after your sahur and when having symptoms of hypoglycemia, the symptoms may include dizziness, cold sweats, blood vision, chills, and etc. Okay, so it is recommended to take a 2-hour sugar level monitoring after your sahur. Okay, and monitoring sugar levels does not invalidate the fast. Okay, just now like pricking the skin, it will not invalidate the fast. Okay, and for people with diabetes, it is recommended not to delay the time taken to break the fast. If you are on the go, it is advised to bring 1 or 2 dates during iftar. Okay, so some people they may want to delay their break of the fast, in which right after azan they want to perform prayer and all that. But for patient with diabetes, it is recommended to take your food right after breaking the fast, okay, and not to delay. Right, for optimal sugar level control, dietitians recommend taking foods rich in fiber. Okay, this is very important, and fiber not only satiates but help to stabilize sugar levels in the body as well. Okay, so it is recommended to take food rich in fiber during your sahur as well as during your berbuka, your breaking the fast. Okay, so when to break the fast? Okay, when experiencing following signs and symptoms, patients should break their fast for their health sake. Fasting is not mandatory for the sick, and alternatives like replacing the fast or paying fidya can be done. So you should not push yourself to fast if you're not able to. Okay, basically, if you're experiencing certain symptoms, especially the hypoglycemia symptoms, it is recommended for you to break your fast. Okay, for example, when your blood glucose level is less than 3.3 millimole at any time during the fast, or when your blood glucose level is less than 3.9 millimole per liter in the first few hours. Okay, so these are the examples. Okay, or when your blood glucose level is more than 16.7, or when there is hypoglycemia symptoms without SMBG, meaning that even without your self-monitoring blood glucose, you experience the hypoglycemia symptoms. So you are supposed to break your fast, because when experiencing hypoglycemia, you are supposed to take any food right at that time as soon as possible. and when you are experiencing severe dehydration symptoms. Okay. Okay, now for inhaler, okay, another device that is widely used by kids or by adults for their asthmatic condition, okay, and it is also continued. The use is also continued during Ramadan. Okay, so basically we have two categories of inhaled medications. The first one, the controller or the preventer, which is example seretide, plixotide, and etc. And we also have a reliever medication. Example include Astalin, Ventolin, and etc. Okay, patients who use the preventers, inhaled medications, may continue using them accordingly, okay, in which this medication is normally taken twice a day and it can be taken before sahur and bedtime. Okay, like I said previously, using inhalers can invalidate your fasting. So you're not supposed to use it during the fasting period. You're supposed to use it while you're not fasting. Okay, preventive medication such as inhalers is vital for optimal disease control. And such medications can reduce the number of asthma attacks when fasting and reduce the need for inhalation type relievers. However, reliever inhalers can be used in the case of emergency, meaning that when you have emergency, you want to use your reliever inhalers, and that time you are fasting, that actually causes you to invalidate your fasting. Okay? Your fasting will not be valid anymore. Okay. If you are facing any gastric problems during Ramadan, okay, a person with gastric problems should avoid taking fried foods or fizzy drinks during your sahur as well as during berbuka. Okay, drinks with high caffeine content such as coffee are also possible triggers of gastric discomfort. Okay, and it is recommended for you to have smaller meals when breaking the fast is recommended instead of having a large meal immediately upon berbuka. Right, so for patients with gastric problems, it is not a problem for you to not fast during Ramadan. You can fast, but you have to adjust whatever you eat during your sahur as well as during your berbuka, so you will not feel uncomfortable during the fasting, at least the 14 hours fasting period. Okay. Okay, so for tips for patients, okay, having sahur, which is the pre-dawn meal, and delaying it until just before fajar, which is the downtime. Okay, eating well, because if you eat too early or too little can lead to hypoglycemia. So the recommended one is to delay your sahur and to take your meal right after your berbuka, right? And then break the fast on time with 1 to 2 dates, and encourage to take the main course after Maghrib prayer. Avoid eating too much while breaking the fast. Okay, so you have to take like smaller meals. Eat food with less sugars, fat, and salt. Okay, take your medicines or insulin regimens according to the doctor instruction. So for insulin, whatever it is, you have to consult your doctor before you simply change your dosage, right? Okay, recognize the signs of hyperglycemia, hypoglycemia, and dehydration. This one, all patients with diabetes, they have to be aware of the sign and symptoms of hypoglycemia especially. Okay, because if you experience certain symptoms of hypoglycemia and you're not aware of that symptoms, you might face problem. Okay, so when you have that symptoms, you're supposed to break your fast. Okay, break the fast as soon as if there are signs that can be harmful, and a patient's decision to fast should be made after careful discussion with their doctor. Okay, supervision, education, personal care, nutrition, and medications modification can help patients control the disease in the month of Ramadan. All right, so for the conclusion, fasting is not a barrier for patients to stop seeking treatments and consuming their medications. The adjustment of dosage and consumption timing according to the recommendations of doctors and pharmacies can help patients navigate through the month of Ramadan. Okay, so you have to monitor properly when you're going to take your medications. Okay, if it is before meal or after meal, you're supposed to take it accordingly, and you're not supposed to skip your medication even during fasting, right? And it is also important to note personal health should always be the utmost priority, and one should not stop taking medication or discontinue treatment during Ramadan. All right. Okay, so these are some of the references that I used during my sharing just now. Okay, and thank you.
Thank you, Ms. Aina, for a great sharing session. So, ladies and gentlemen, now we have come to the question and answer session. So, for those participants who have any query or doubt to the speaker, maybe you can just type in your question in the meeting chat box so that I will read out later to the speakers. Okay, before we continue to the Q&A session, I would like to again announce that we have posted the attendance link in the meeting chat room. So for participants who participate in our sharing session today, we will provide the e-certificate according to the attendance list. And after the end of the Q&A session, the host will again share the feedback link so that if you have any feedback or any improvement that you want to suggest to us, feel free to share with us. Okay, so we have one question. Basically, for the first question, Miss Aina, I would like to ask and confirm again. I think just now I heard regarding the sublingual things. Is it the drugs that being put under our tongue?
Yeah, it is medication or tablet that is supposed to be put beneath your tongue. So you're not supposed to swallow the medication.
So if only it is used under tongue, it
Yes.
is won't be invalidate our fasting.
Yes, correct.
So if we accidentally swallow it, means our fast is valid.
Yes, correct.
Okay, I understand. Okay, so the next question from the Facebook link, they have asked on the drugs being inserted in our buttock.
Okay.
Is it what we call, Miss Aina?
Is it the enema and the suppository?
Yeah, for
Okay.
so that we can avoid the constipation. So
Yes.
basically, will it validate our fasting?
Yeah, those medications will also invalidate your fasting. So if you're fasting, you're not supposed to take those medications, including the pessary that is inserted through the vagina.
So for the last question, so I'm just curious regarding as a breastfeeding mother, Miss Aina. So basically, a breastfeeding mother can just continue breastfeeding her child, or we need to like just put a stop, don't fast and etc.
Okay, usually for breastfeeding mother, if I'm not mistaken, it will not invalidate. It will not invalidate your fast if you breastfeed. If you breastfeed, but for example, if you decide to breastfeed, during your sahur, you at least need to take enough nutrients. You have to take a healthy diet and enough nutrients to ensure you can fast during the day. However, if you feel like you're not capable enough and it may threaten your condition, your health, you can just break the fast. That is recommended actually.
So I think so far in the meeting chat, there are no more questions. So can we wait another around 1 to 2 minutes? Maybe we can allow the participant to ask anything. Okay, so for the chat box, another question came in. So the question is, any difference in the use of insulin for type 1 diabetics?
The type 1 diabetic, actually you can just use it like the doctor's recommendation, in which you can just take, for example, like just now, if it is pre-meal, you can just take it after you break your fast and after your sahur. Okay, so just can take it like normal lah. Even for, the recommendation is almost the same like type 2 diabetes mellitus, just now as I've already explained.
Okay, so I think that's all for the question from the audience as well in the meeting chat room for Zoom as well as the Facebook link. So I thank Ms. Aina for sharing with us a lot of information today. We hope that the information will give a useful topic for everyone. So ladies and gentlemen, now we have come to the end of the session. So before we end this ceremony, I would like to thank everyone to participate in this sharing session. And I would like to thank the organizing committee and everyone that involved directly and indirectly to make this session successful. So I would like to remind that our series will continue for up to 6 series. So hope that everyone will participate the remaining series as well, so that we can always share the knowledge with everyone. So with that, we end this session. Thank you, everyone.
Thank you.